Hi guys, I want to do a quick video here. This isn't going to last very long, but this is about something that a lot of you are doing out there that's absolutely destroying your gains. It's destroying your ability to be fit, and it's going to destroy your health in the long run. And you might be surprised by it. It's taking certain over-the-counter pain medications, particularly NSAIDs, non-steroidal anti-inflammatory drugs. This includes aspirin, it includes ibuprofen, it includes Motrin, a lot of these NSAID-based pain relievers that you get. And the problem is that a lot of times we're taught to think that these drugs are very, very safe. And for many people, yeah, you're not going to see too much of an immediate side effect from taking these, right? They're very effective at relieving pain. They're very effective at relieving headaches. But there's a big amount of problems that are associated with taking these things. And I know of a lot of people who are out there in the fitness world, who are training, who will think nothing of popping a couple of these pills directly after a workout. That's a big no-no. And if you're taking these chronically, or if you're taking them often, even if you're taking them every week, there can be a lot of problems associated with that. So let's get into why. Non-steroidal anti-inflammatory drugs, they cause their effect because they shut down inflammation, right? Now, one thing about the recovery process, for those of you who tend to take these things post-workout, is that a little bit of inflammation is necessary in order to recover. Right? Now, we think of inflammation as being a really negative thing. That's what leads to the aches. That's what leads to the pains. If you know a little bit more about inflammation, you also know that chronic inflammation can cause things like decreased insulin sensitivity. It can cause things like chronic injuries. It can cause diabetes, heart disease, and cancer. But here's the thing. Some inflammation is definitely necessary to kickstart the recovery process, right? So when you're lifting weights and you are tearing your muscles apart, it's that inflammatory process that kickstarts muscle protein synthesis and your ability to repair that damaged tissue after a workout. And so, you know, if you're taking one of these non-steroidal anti-inflammatory drugs right after a workout, you're literally completely shutting down your recovery process. And that goes for a lot of other anti-inflammatories too, even ones that I would still take. Like if you're taking omega-3s, I wouldn't take them directly after a workout. If you're taking curcumin, I wouldn't take that directly after a workout, right? You want to wait a bit before you're taking any sort of anti-inflammatory product because the inflammation right after a workout is going to be your friend. But there's a bigger issue here than just building muscle and recovering from workouts, and that is your overall health. And so a couple of things you have to understand about your body is that, number one, your intestinal tract is really the center of your health, right? A lot of your immune system is centered in your intestinal tract, up to 75%, right? The other thing is that the interior lining of your intestinal tract, it needs to constantly repair itself. And if it doesn't get to repair itself, then a lot of openings can form, you know, lesions, ulcers, things like that. And when you have things like that happening in your intestinal tract, you got to remember your immune system separated from the waste products in your intestinal tract, sometimes by a lining that's a single cell thick. So if that gets damaged, things can come in contact with your immune system, and that in turn can raise levels of inflammation, right? So what does that lead to? It leads to leaky gut syndrome. That leads to a lot of the things we think when we're thinking about inflammation: achy joints, increased propensity for disease, brain fog, autoimmunity, you know, Crohn's, colitis, rheumatoid arthritis, lupus, you know, a lot of these other autoimmunities that are becoming more and more common, that can all happen through the intestinal tract. Now, if you're chronically taking these NSAIDs, one thing that can happen is it can keep your body from repairing that anterior lining each night. And so you can make any situation, a negative situation that's in your intestinal tract, much worse by taking these NSAIDs. So that's a very big thing to consider here. And if you're taking these, you probably shouldn't take these often. I mean, I really wouldn't take them more than once a month, and that's only under very, very necessary conditions. But if you're dealing with pain, there are other things you can go for. There's a few different curcumin supplements, very strong curcumin supplements that you can get. This one here is called Curamin, right? And this is a curcumin-based anti-inflammatory that can help you with achy joints, it can help you with headaches and chronic pain. You could also go for another one, it's called phenylcaine, and that's a mixture of curcumin and a bunch of other anti-inflammatory compounds that you could take. You'd also, if you're getting chronic headaches and you're dealing with joint pains, you might also want to consider cleaning up your diet, making sure that you're getting a healthy dose of omega-3s, making sure that you're eating a more anti-inflammatory diet, right? Getting some good healthy fats in there, avoiding sugars, avoiding processed foods that contain a lot of omega-6 fatty acids, which raise inflammation. And if you do that, then that can reduce your propensity for getting a lot of these aches and pains, and that can actually help to enhance your recovery in the long run. But just, you know, like with all the other anti-inflammatories I was talking about, don't take things like this immediately post-workout. You want to wait a little bit. I would wait at least 3 to 4 hours after a workout before taking something like this. So that's what I got for today, guys. If you are interested in hearing more stuff, I've got a whole podcast out there. It's called the Warrior Soul Podcast, and it's centered around helping U.S. military veterans and anybody else who's willing to listen to live their best lives. And every Monday, we're posting an interview with an expert in some sort of area. In the past, we've talked to Dominic D'Agostino, we've talked to Mark Sisson, I've talked to Dr. Terry Walls, Chris Bell, Les Stroud, the Survivor Man. Really awesome interviews up there. On Wednesdays, we're posting a fitness Q&A, and that's where I answer different types of questions from our private Facebook group. And on Fridays, we're posting an in-depth discussion about a specific subject, usually something to do with current events or some sort of tool or tactic that you can use to push your life forward. So definitely check out the podcast. If you like this video, please subscribe to the YouTube channel. Hit that bell next to the subscribe button so you know where I'm posting videos. And that's it. I'll talk to you guys soon. Peace.